So the specific risks of breast augmentation are related to the fact that we're implanting a foreign body into the breasts. Foreign bodies are man-made, and so they don't have an infinite lifespan. So for example, implants can rupture, implants can rotate, implants can cause a reaction in the body that's called a capsule. Capsule contracture is the commonest complication from breast augmentation, but with modern devices, with good antibiotic prophylaxis and good surgical protocols, we minimise the risk of capsule contracture to somewhere around 1 to 5% within 10 years. Capsule contracture is when the scar tissue that forms around an implant contracts. It thickens and contracts over time. And in the first signs of that, it causes some hardening of the breast and perhaps some distortion of the breast. When it goes on for years and becomes even more severe, it can cause pain. And usually that's a fairly significant thing in patients and is an indicator that they need to do something about it. Some patients will choose to get something done much sooner than that. Other complications for teardrop-shaped implants, they can rotate. The rotation risk is rare, is low, and it's quoted as somewhere like 1% of devices will rotate in the patient. And there are things that the patient and the surgeon can do to minimise that risk. Other implant-related risks include implant infection. Infection in implants is extremely rare, and in my practice it's not something that I've ever seen in patients that I've treated. I have seen implant infections in other patients, but fortunately in my practice it's a rare complication. Implant rupture is also rare, and the manufacturers quote a rupture rate under 1% within 10 years. And the majority of devices now have what's called a cohesive gel, which means that even if the device was to rupture, the gel doesn't flow through the breast like some of the older gels and older style implants used to do. Signs of implant rupture include a change in the feel of the breast and in some cases a change in the shape of the breast. But in the majority of cases, implant rupture is detected as an incidental finding following some sort of breast screening. So ultrasound and mammogram can sometimes pick up implant rupture, and that's the commonest way that devices that have ruptured are now picked up. Some patients feel that the implants they've selected is too small or even too large. It's really uncommon for girls to feel that they're too large, but the majority of patients, once the devices have been in for more than a couple of months, will feel they could have gone larger. I tend to advise patients to, when I'm sizing them preoperatively, to pick a size that seems a little bit large but that they could live with. Because in most cases they'll be quite comfortable with that decision in the fullness of time.